So it's a great pleasure to introduce Rohan Talbot. Hi, Rohan, how are you? I got a brief bio from the organizers, and you are the Interim Director of Advocacy and Campaigns for MAP, Medical Aid for Palestinians, an outfit we all know and deeply respect. And you work on health and development to support Palestinian rights, particularly their rights to health and dignity. You've worked with MAP since 2015 and recently completed a part-time master's in international human rights law at Oxford University. And prior to joining MAP, Rohan held a number of advocacy and human rights roles and with organizations in the UK and Lebanon. And today, Rohan, you are joining us to speak about advocacy. And then as I understand it, I will add a few remarks after you have spoken, and then we will open it up for conversation. So Rohan, the floor is yours.
Thank you very much for that introduction, Dr. Leaning, and thank you to the organizers and everyone who's here. It's a real privilege to be with you all in such esteemed company. And also, before I start my presentation, I'm going to apologize in the interests, should we say, of putting theory into practice. I've managed to contract COVID for the first time over the last few days, so I'm presenting through a bit of a fog and with a slightly croaky voice. So do bear with me, but hopefully things will be fine as I go through. So I'm just going to share my screen. Hopefully that has worked now. Do let me know if you're not able to see that. So I've been asked to present briefly on the topic of advocacy, the what's, the whys, and the hows. By way of a very brief introduction, I'm sure many of you know about MAP, Medical Aid for Palestinians, but in brief, we are a health and development organization working in the occupied Palestinian territories and in the refugee camps of Lebanon to further advance a vision of a future where all Palestinians can access an effective and locally led system of healthcare and enjoy the full realization of their rights to health and dignity. And as you can anticipate, as an international organization doing these sorts of, an NGO doing these sorts of work, most of our work is programmatic. It's partnerships with community organizations, it's partnerships with the Ministry of Health and with clinicians to support the development of services over the long term. But as an organization, particularly an organization that grew up following the experiences of certain medics working around the time of the Lebanese Civil War and the massacre in Safra and Shatila 40 years ago, there's always been a recognition at MAP that a lot of the, let's say, most of the barriers to the vision that I just outlined are political and social and economic. And therefore, we have a team of which I'm one of five in Palestine in the UK that works on advocacy. And so my presentation today is really going to look at why advocacy is a relevant topic for health researchers and for a conference like this. What it really means when we're talking about advocacy, and then talk about how this can be pursued and achieved. Some of this will be very familiar to lots of you, but hopefully there's a few bits in here that might spark some ideas. And obviously, if there's opportunities to discuss at the end, I'm very happy to do so. So starting off, the question, what is advocacy? Briefly, and in its simplest form, when we're talking of advocacy, we're talking about action taken to create change within our social and political systems. At its core, advocacy is about understanding and influencing power within those systems. It's contrasted, shall we say, with direct intervention in support of people and communities. It can happen at a number of levels. At the individual level, of course, patient advocacy, advocating for a patient to be able to get access to the treatment that they need. At the community level, advocating, for example, for a specific community or a village to be, for example, connected to the water mains or to for an end to violations that are occurring there. It can happen at the societal and national level. Obviously, we're talking about advocating for an end to occupation or to apartheid. And at the international level, of course, thinking about issues that transcend boundaries, such as climate justice. While we might be talking about sometimes that occasionally can give immediate results, a lot of the time we're really talking about a longer term process that involves a lot of different actors, partnerships and targets, shifting narratives and perspectives over a long period of time, building relationships and creating the foundations for a broader and more impactful change in policies and behaviours. Within our discussion, we're obviously thinking about how do we influence an array of actors and systems to improve the health and well-being of Palestinians and Palestinian communities. So the question, why is that relevant? And with thanks to Graham Watt, who put me on to these quotes, and particular the work of Rudolf Virchow, there's two quotes that I just want to start this part off with. Firstly, medicine is a social science, and politics is nothing else but medicine on a large scale. Medicine as a social science, as the science of human beings, has the obligation to point out problems and to attempt their theoretical solution. The politician, the practical anthropologist, must find the means for their actual solution. And so this really illustrates the inseparability of health and politics. Those of you here who are health researchers, a lot of the time are describing and documenting the impact of politics on the individual body or on the group. And that also comes with an opportunity to be able to make recommendations and pursue change in order to support people over the longer period of time so that their health, their dignity, their ultimate well-being can be achieved. Second quote here, science for its own sake usually means nothing more than science for the sake of the people who happen to be pursuing it here. Well, that's why I guess the LPHA to some extent exists, is to recognize that science isn't for its own sake. It is there, we're not here in the business of producing knowledge in order to produce knowledge to sit on shelves, but rather in order to pursue a better future, to improve health for the people that we work with and for. And so it's pretty clear, perhaps, to say, it's been mentioned a lot already today, it was always the background to these conversations, that Palestinians' health needs do not occur in a vacuum. They are the product of complex and overlapping social, economic, legal, political, etc. factors, which include, of course, historic and ongoing injustices, violations of international law, and systems of oppression, including occupation, perpetual displacement of refugees, apartheid, colonialism, siege, etc. Economic deprivation and inequality, and the de-development and fragmentation of the healthcare system and infrastructure. Global health issues and inequalities, such as, for example, vaccine intellectual property rights, and the limited national health resources and competing priorities for health authorities. And so the role of advocacy is to identify what it is that needs to change, how that change can be achieved, and who has the power to make that change, and to develop and implement strategies to pursue that. So briefly, to focus on how do we advocate, particularly as individual researchers, as individual advocates, or even as organizations large and small, we lack the power to influence those larger factors that I just mentioned. You know, any NGO or researcher might recognize that occupation and the policies and practices that make up Israel's occupation have deleterious effects on Palestinians' health in all sorts of ways, but we don't have the power to make an impact really on whether that occupation continues, for example, or even whether specific policies within the occupation continue. And so that means that we have to break down larger problems into smaller ones and produce to understand a theory of change. And what I presented here is the theory of change that we use at MAP. It's a fairly general one, but perhaps it gives some good indications of how this can be pursued. So as you can see, there are three sections here. The sphere of change, that is those broader contextual factors that undermine health, undermine dignity, etc., which I've outlined. Our work as advocates is to understand who has influence on those particular contextual issues, whether they're health authorities, whether they're local or international governments, whether they're the community, whether it's narrative, it's about the media or social media or the public at large. And what we want to understand is who it is, what power they have, what are their agendas and how do we influence their attitudes, their behaviors, their policies and their agendas over time. And then, of course, it's for us to think about the sphere of control. That is what we as individuals or as organizations are able to do. What are the outputs that we can produce in order to pursue change and to influence those targets and actors? To dig into this a little bit more, I'm proposing here a sort of step-by-step guide. It's an oversimplification, but it's something that perhaps can be thought of within the realm of an individual researcher or an individual piece of research to think about how are we using this in order to pursue change at the systems level. Firstly, laying out your aims and objectives. This is perhaps in some ways the hardest, but in some ways also the easiest aspect of it. What is it? What is the change? What are those factors that are affecting the health or the well-being of the community or the individuals that we're seeking to support? That's really a lot of the time where the health research, important, evidence base comes in. If we want to understand what it is that needs to change, then that needs to be done on the basis of a quality evidence base. And so the first step in advocacy is really the work that all of you are doing in your research, setting out what are the challenges, what are the problems, and what is it that needs to be changed. But as I mentioned just before, identifying that there are broad contextual factors, let's say, for example, the issue of the impact of pervasive violence from the Israeli military and settlers on the health and mental health of children in the West Bank. That's a large set of problems, the presence of settlers, the occupation, the policies and practices of an occupying army, etc., that are quite difficult to tackle. And so it needs to be broken down. What are the steps needed in order to adjust and address that system? Is it specific policy change? Are there narrative shifts that have to happen? Does it need to be local or international or both? And so laying out the problem is always the first step in advocacy. The second step is to map those with power to make the change and identify the targets, those individuals and organizations and systems that we want to influence. So as I mentioned, this can be local authorities. It could be, for example, the PA, the Jordanian or Lebanese governments. It could be third states, governments like the UK or the US, international forums such as the UN, the Human Rights Council, the General Assembly, the EU. It could be specialist or expert groupings such as other researchers, journalists, identifying partners that we want to work with and also to influence in the auspices of a broader campaign. And it also can be at the local level, whether we're looking at trying to influence health behaviors and understanding as well. So we need to understand that, and there is an element of mapping that needs to go on before we implement any strategies to try and pursue change. Following that, the implementation stage, or the design and implementation stage, is about planning and implementing a strategy to match to these targets. And so there's a broad array of activities that can be relevant here, producing materials, reports, policy briefs, infographics, videos, etc., hosting meetings, including this. This can be classed as the LPHA itself is a form of advocacy. It is it about informing other researchers and people in this space and helping them to go forward and pursue change together. Outreach, targeted emails, broadcasts, social media, traditional media, whatever that might be, and also campaigns, engaging our broader publics and the communities in pursuing change together, empowering them to contact their representatives or take public action as well. All of this, I should say, needs to be targeted and related to the individuals we're seeking to influence, and I'll get onto that in a few minutes. And then finally, follow-up is essential. It's helpful to think of what you will do first and then what you're going to do afterwards. Advocacy doesn't change these broader factors overnight, and so we have to recognize that there is a timeline to the work that we're doing here. And so, for example, a very specific example, if you're trying to get a specific policy or a specific health practice picked up by an institutional body, you might start with a meeting and then move on to a bigger ask. You want to host a roundtable on the issue, or you want them to make a pledge towards certain things, and building relationships over time is an essential part of it. But also you need to evaluate on an ongoing basis what has been achieved and what can be improved in order to continue to learn as we go. One thing I should say about all of these stages from 1 to 4 is that at every possible opportunity, they should be influenced by, they should be led by those individuals and communities that we are trying to support through this work, that we're actually advocating for. Laying out the aims and the objectives is pretty useless if you're not doing it in a way that is actually aligned to the interests of the people that you're trying to support. Mapping and influencing targets is far more effective if it's done with the full participation of those affected communities and individuals. Finally, I wanted to try and give a sort of practical tool, a set of principles that I think might be helpful to think about specifically research and data and transforming it into action and into advocacy. And so I've laid out what in search of an acronym I've called the FIRE principles here: framing, inspiring, reaching, and enabling. And this is maybe 4 things that could be thought of if you have a research paper that you think is of relevance to policy, or that you think might have some recommendations that it would be useful to be adopted beyond the academic sphere. There are 4 things here that I think are worth bearing in mind. So let's take a concrete example from the work that MAP does. More than 15 years of evidence pretty unequivocally demonstrates the impact of Israel's illegal closure and suffocating siege of Gaza on patients, particularly its permit regime. And we have a solid body of evidence that shows that it has a direct impact on the health of cancer patients, their physical and mental health. Assume that we've done all of the strategizing and targeting before. We've identified a group of actors that we want to influence, that they have power to make some adjustments to this issue. How do we use the information, that data, that research at our disposal to mobilize them to make that change? And so these 4 principles are, firstly, framing. So the data that we have produced needs to be produced in such a format that the target audience can understand it and can use it. It needs to be persuasive to them. Do politicians read academic articles? Well, with exception to the esteemed minister that we've just heard from, who I think is a very rare example, generally no. Politicians are not reading the Lancet. They're not reading academic articles by and large. They don't probably have the time to do so, even if they were inclined to read those. So that's why organizations like MAP spend a lot of our time collating and reformatting data and research into advocacy-focused reports, short briefings, concise, easy to read, and designed and written in such a way to connect to the target's agendas and priorities. For example, if we were talking to a health authority, we might frame it in terms of their own national action plans, or if we're talking to foreign governments, we might be focused on international law. Secondly, inspiring. Data and a firm factual basis are, of course, essential, as I've mentioned, and really no advocacy can be done that doesn't have a firm basis in reality and that isn't backed up by quality research and evidence. That's why the work of the LPHA and all of you is so vital. But it's not always sufficient. In advocacy, certainly, emotional appeal and human stories are often a part of advocacy for good reason. The more personally invested an advocacy target is in an issue, the more likely they are to take action. So, for example, if you conducted interviews as part of your research, were there quotes that you think were particularly illustrative or impactful from the interviews that you conducted? Can you connect the targets directly to a person or persons affected by the issue that you're working on? A specific emblematic case for the issue that you're trying to illustrate is often much easier for people to grasp and connect to than general data on the issue. And so that's why organizations like MAP work to, for example, bring politicians from the UK to Palestine to speak to communities directly. We work through videos, virtual calls, etc., to try and make connections and human connections, as well as providing a factual basis for the policy work that we are promoting. Thirdly, reaching. So perhaps an obvious one, but it's an easy step that lots of us fail at. Data needs to reach your target audience. Are advocates, journalists, the public, the people that you're trying to reach, are they able to access the information and the data and the research that you're producing? We're all busy, but it's surprising how often even in my work day to day, we'll produce something and I'll forget to send it to the right person and to follow up and say, it would be great to have a call to discuss this. There is an element of quite simple outreach that can be done, but also we need to think about where our targets are getting their information from. Do they need it to be published online? Are they likely to see it if it's shared on social media? Should it be launched in an event so that they mark out time in their diary to think about the issue that we're trying to present? What sources of information do they trust? Should it be promoted to the media in the hope that that will influence them? So thinking about how we're going to reach those targets is vital too. And then finally, enabling. If your data, your research outlines a problem, it needs to be presented with recommendations for action that can be taken to address these problems. Don't assume that your target at any point will know what to do with the data, particularly as they will have many competing priorities and agendas and other people speaking to them. So recommendations where we make them should be what we call SMART objectives. So they should be specific, they should be measurable, they should be achievable and relevant, i.e. The target should be able to enact them, and they should be relevant to solving the problem that we have in front of us, and they should be time bound. So we should be thinking about how our targets are going to actually act on the information that we're presenting, and having a clear, as I mentioned, a sort of stepwise process of what we're actually asking them to do, both small asks to begin with, larger asks over time as relationships have been built. There's so much more that I could say, but I won't. I'm going to stop sharing now. I think I've spoken for my allotted time, but I'm very happy to answer questions and into discussion now.
So, Rohan, thank you very much for a lucid and comprehensive discussion of advocacy from the standpoint of an organization with long roots in the region. I realize we're short on time. I was asked to make a couple of comments, and I very much think that what you have described is a broad, deep, and still accurate sense of what advocacy requires. So, bravo. And it doesn't show at all that you are at all impaired. So I'm even more impressed. So I had a couple of things to say that from the standpoint of individual or small group advocacy rather than sort of the enterprise that MAP has become. But I think it's relevant or reverberates with what you were saying. It's necessary to situate yourself or the organization in the context of knowledge and experience that you have with the population you're talking about. So you began by saying 30 years plus of experience, and that's very, very important. All right, when you're doing this. Secondly, demonstrating that you yourself or the organization has a command of the facts in the literature. Difficult to do in a short presentation, but still necessary. Okay. And then this notion of the accuracy, or that is the use of evidence. This is really very, very tricky. In other words, and you pointed this out, you don't go beyond your database. You also don't try, and this gets to another principle, which I was calling parsimony. That is, you choose what you really need to talk about. You don't throw the kitchen sink at everybody. You're focused, but you begin by showing that you know a great deal, and then you focus. This is particularly tricky when you're doing reports, but it's also important when you are actually giving verbal reports and presentations. Be careful about how you use the evidence regarding examples. It's very, very tricky because you can, even with great care and experience, you can inadvertently get individuals or small groups in trouble. You have to know how to pitch to a multinational audience, where some examples will have more meaning than others. You have to contain how you had access to information so you're not divulging a confidential access. And I think you said this in your FIRE slide, which is wonderful, that you have to show respect for the audience as well as for the populations and individuals that you are trying to advocate for. Respect for the audience, very important. And I think you did that well. And then convey a clear message about what the next steps should be. And as you say, a clear message for whom you're discussing, but also coming from, as you put it, where your sphere of control is. So that line of how you put thoughts and research into action is extremely important. What is the clear message about what to do? And this is difficult when one is dealing with something as complex as whatever it is you're talking about relating to Palestine. Everything is complex. So it's this point about staying in line with your own expertise. I mean, as a physician, I have done a lot of advocacy in the context of human rights work. But you need to ground yourself in what you're good at so people realize you're not filled with bravado and overreaching. And you also have to convey important ideas and suggestions that come from the local community that's affected, and from respected international agencies that are going to be your allies. So you need to mobilize some support behind even your individual suggestions, and even as an organization, somewhere in your reports echo, this has been, and it, your master's in international human rights law is going to be excellent. This has been referenced in this document and that document. There's got to be a sort of external source of validation for some of the points you're making. So you actually covered that beautifully in your presentation. And I would just stop here and open the floor for questions with, if there's not time afterwards, to thank you again for a marvelous talk. So I think we're open for questions. So there's a wonderful note from Rita, which says that you have given a good talk. And her question is, how do you assess the effect of advocacy, given that there are several variables that can influence conception, policy, or action, which you cannot freeze?
Thank you very much. And also, just to respond to your comments, I just wanted to endorse everything that you'd said, and just to emphasize, in an increasingly contested, in some ways polarized, and we could say hostile environment, particularly for the work that we do, expertise is still valued and valuable. And I think that that's why, this sort of forum and those of you here who are researchers bring a certain gravitas to advocacy that I'm not a health researcher. I don't have the same, I'm not thinking about the same problems day to day. And so we need to think about our niches, and everyone here that's on the call has a specific niche to play within advocacy. And on the basis of your expertise and the research and the work that you do, it's still incredibly valuable. And one of the things to think about when we're thinking about the complexity of these systems, pivoting to your question, Rita, is recognizing, when we think about those niche, but recognizing the opportunities for partnership and the opportunities for collaboration and cooperation, because we are but one part of a broader movement for Palestinian rights and liberation. We focused on the health aspects of that, which are significant. With the question of evaluation, this is something that we think of all the time, and in the process of developing a new strategy for advocacy at MAP recently, we've grappled with this. And it doesn't feel great, because as a social scientist, we want to be able to control and account for all variables, but that isn't possible within something as complex when we're really thinking about, what is the impact of the occupational health, such a broad question. And also, Dr. Lin, you mentioned the issue of needing to be very specific, but being very specific also brings risks, because if you have a myopic focus on a specific aspect, you can make recommendations that fail to account for the contextual drivers of health needs, and therefore you end up, as we would say, moving the chairs on the Titanic. So what we tend to do when we're thinking of evaluation for advocacy is that it is looser. We have to rely on our own experience in this sphere, and we have to make certain assumptions. And so the way that we actually break it down within our own work is that we have a separation between what we expect to see. So with the various targets, and given the type of actors that we do, are we seeing what we expect to see? So if I send a briefing to MPs, members of Parliament in the UK, I expect that they are going to respond and that they're going to acknowledge that they've received it, and that a certain proportion of them will, for example, table questions in Parliament on the basis of what I've asked. Then we have what we would like to see, and then further ahead, what our ultimate goals are. So you can start to what we call outcome harvest. So looking at your targets and looking at your activities, you can lay out a list of, well, here's what I expect to see just doing my work day to day. Here's what I would like to see. So that parliamentarian, if they start to come to me proactively, I want your expertise, I want your help with this problem, I want to represent, in Parliament in the UK, the issue of cancer patients in Gaza. If they're doing that proactively, that would be something that we would do in the like to see. So you can see you're having impact on targets. The question of whether you're going to be able to really accurately measure whether you're having impact on the sphere of change, it's usually safe to not worry too much about that, because we will notice if there are big changes in that bigger sphere, and we have to recognize that we are not alone going to make impact. So it's more important to see whether you are we're using the assumptions that what you're doing is based on a theory of change, and therefore that it should have impact down the road. Focusing more proximally to what it is that you're doing, what you expect to see and what you would like to see, is usually enough for having a guiding force on your advocacy. And also you can ask your targets, is what I'm doing working? Is it helpful to you? A lot of the time that's enough.
There's a question, very good points. There's a question that comes from Lancet Palestinian, which is, are you taking account in MAP of the current discussions within Palestine and among the diaspora regarding moving from violence of occupation to really systemic issues of colonialism? And so specifically, are you considering the grassroots changes as you go through your planning cycles in MAP? In terms of,
Yes, I mean, the answer is yes, absolutely. And it's a continuous challenge for us. As an organization, we have an advantage, I guess, in that our work started in Lebanon, and therefore, we're not so rooted to the model of looking only at the occupation, which a lot of organizations are. We take a perspective, and we've been doing work over the last 2 years, I can say, to try and reformat the assumptions and the ways that we are approaching this work. Most importantly, I should say that we get our legitimacy from the communities and the individuals we serve, not from our funders, should we say, and therefore we have to be connected to these discussions. Laith, I'm sure you're aware, and I think lots of other people will be aware, that also comes with certain challenges, because we work in a contested sphere, and by and large, MAP is a service deliverer and a partner, and therefore we have a lot of work that we're always doing, balancing our understanding and correct, we hope, analysis of the situation with what is possible within a risk scenario that very easily can have organizations like MAP shut down and shut out from the programmatic work that people rely on the ground. And so that's a constant balancing act. But it's always a live conversation. In fact, it's always alive. It's a daily conversation, whether we are doing justice to the understandings of Palestinian civil society. And that's why partnership is important, and openness with, we work with organizations who are at the forefront of this. LPHA and JLAC and Al-Mizan and all these others are our really valued human rights partners on the ground. They understand that we form a specific niche, but we try and bring something to the table that doesn't ever contradict what they're doing, but is supportive to those organizations, whilst also balancing the risks of doing advocacy in an organization that isn't solely an advocacy organization.
There's a question, but I'm looking to the chair to tell me when we have to stop. But there's a question here that is I'm not sure it's entirely in your zip code, okay, but it's asking, how does MAP handle research and advocacy around very sensitive issues, sensitive within the population, such as gender issues, gender-based violence? To what extent are you aware that an organization like yours may or may not be the best vehicle to begin to carry the charge, so to speak, for advocacy?
It's something that a number of our partners, both in Palestine and in Lebanon, work on these issues from a pragmatic perspective. I presented a view of advocacy that is skewed, I guess, by the fact that I'm the director of advocacy sat in Lebanon, but it doesn't contain perhaps as much of a focus that would be more rounded in the fact that advocacy is done at all levels of MAP, and particularly a huge amount of advocacy is done at the programmatic level. And by that, I mean, we are supporting local and community organizations who know far better than I ever would about how to sensitively and appropriately broach, research and broach these issues at a community level. So we do work on issues such as sexual violence. We do that in a sensitive and local way that is largely led by our programs teams, because there isn't, let's say there isn't a particularly helpful international angle to trying to address that, and it is for community members and survivors and others are the sort of lived experience experts who can pursue that sort of advocacy. And so it's really for us to also recognize that a huge amount of advocacy goes on day to day through our programs, through our partnerships, or through supporting community organizations. So it's part of our work. It's always part of our work, but it's done in a way that recognizes that the targets for that sort of advocacy are pretty local. They're hyper-local, in fact. And so it comes as part of a package of other supports, providing health services, psychological supports, group sessions, etc., for people who are affected. And from that, using it as the basis to create confidence and skills for people to be able to go out into their own communities and advocate and raise awareness around these issues too.
Mm-hmm. Thank you. Now we have, I don't see the two people who raised their hands. Welcome, Dr. Essie. Glad you're here. There's a question here that comes in the chat, and that's really what I'm seeing. We, I think, have permission to go till 9:30, so we'll do that. And there's a question from Amal Watfa Karaki to everyone, but it goes to you, I think, first. Don't you think that we need to aim for more impact and not be content that target was accomplished in light of the complexity of the situation? I think you follow that line of question, right? If you're too specific, you're aiming too low.
I mean, there's not much to say, but we're always aiming at impact. What I would always say is that impact needs to be thought of over, we're doing advocacy. We tend to, I'm going to restart what I'm saying there. A lot of the time we can think of advocacy as being what is immediately in front of us and put together strategies for 6 months or a year to try and get something changed. But we're talking about intractable political, economic, international and local factors that really do deserve impact, and recognizing that we have a specific niche within that. And so when I'm thinking about my advocacy strategies, I'm thinking of a 5, 10 and 20-year term. I'm not thinking about well, I am thinking about what can be achieved immediately because there are immediate needs. But I think it's always important to balance, trying to have lots of impact and noise straight away with building those relationships over time, and in order to have impact over the broadest time possible. A lot of the time you could spend an entire year just building relationships, and that would be a better use of your time, as long as you know what you're going to do with those relationships and you actually capitalize on it later. That would be more impactful over the longer term. And so I think impact has a temporal aspect to it that is really essential, and that sometimes can get lost. One of the things I would say, though, there is a balancing act that I think that, particularly in the industry, we could say, that I inhabit, sort of international NGOs, that there is a lot of the time, I think, reluctance to be impactful or to be loud. Obviously, sometimes that's a risk calculation, but sometimes it's simply about fealty to, focusing on the target. And a lot of the time, the people we're talking to, let's say politicians in the UK or internationally, don't care a great deal about the issues that we're focusing on, and our job is to try and make them care. And so I think that there is a constant push externally to us, which we welcome, and also internally within organizations like MAP, to be more impactful, to be louder with the work that we're doing, because the issues are so urgent on the ground. One of the easiest ways to do that, of course, is to just tell the truth and to illustrate what's happening. It is so urgent, it is so desperate, especially now, that actually just simply speaking and without self-censoring or anything else, but showing fully what is happening to people and to communities, is in a space where actually these sorts of things are not shown internationally a great deal, they're not given the coverage that they're due, then that can be quite radical in and of itself, and that's what organizations and individuals can do.
Rohan, thank you. That's a wise answer, in my view anyway. We have two people that I know I need to talk to, have questions, and we're supposed to stop at 9:30. So this is, your answer is going to have to be brief, and I'm going to make it hard because I'm going to ask each of them to give their question, and then you have one chance to respond. Okay? All right. So Dr. Lessie, please, can you unmute and ask your question?
Yes, thank you. Thank you so much. Thank you, Dr. Rohan, for your amazing presentation. My question is that, don't you think that working and coordinating your work with other NGOs, especially working in the Gaza Strip, will have a better yield? Because especially I see that we have in Gaza so many international organizations, and many of them unfortunately working in the same field, but this organization start to generate some money for a certain project. 6 months after, another organization will start in a separate, completely divergent route to implement the same project, and a third will start, and a fourth, and a fourth. So I think if joining all these efforts together, we will have save lots of resources and expertise and time, because there's a lot of wastage of time and efforts and money, which could have make the service, especially for cancer patients, much, much better. We know that cancer patients in Gaza alone costing the government more than 200 million shekels a year of referrals. But why haven't we established a proper cancer care in Gaza since long time, even though we could have achieved something in the past years? Fortunately, with WHO support and NORWAC, we are now working towards establishing a radiotherapy department. Hopefully the Israelis will approve for that. But aside from this, major issue is with chemotherapeutics for all cancer patients. Imagine a patient is traveling abroad just to receive 5 sessions or 10 sessions of chemotherapy. If these efforts were made collaboratively with others and in collaboration with other NGOs, maybe we could have brought all these medicines and made these medicines available inside Gaza Strip, so patients don't have to bear all the hassle and the suffering while traveling and being refused all over and over again. Thank you.
Thank you. Great question. Now we're going to go to Khaloud. Please ask your question and then unmute yourself, and then we'll have a brief response from Rohan. Please go ahead.
Okay. Thanks for everybody for such successful event. Rohan, thank you. I salute this session, and I'm very happy for allocating a special session for advocacy. My name is Khaloud, but I'm professor in community medicine and health policy and management. And I feel that we don't give enough attention to the advocacy issue among health profession, because that's what we need to have and to train these people for, in order to really influence the community towards better health. Second, when we talk about advocacy, are we really, you were talking about influencing policy and changing behavior. We're talking about big challenge of influencing the mindsets of the people, not only by the message, but also with our humbleness, with our attitude, with our approach. We don't have the power, but we have the knowledge and evidence that needs to somehow bring the insight in the political figures and among people towards changing the policy and the behavior towards better health. And the third thing, I want also to commend MAP for all the work they do. And about the MAP change policy, or MAP change, does it stem from the logical framework I like the way you work and how you phrase the purpose and outcomes and actions and super goals. But I liked it because we teach this to also to health professions, because they really need to do community projects. And big part of this is the advocacy
Thank you.
among the grassroots and so on. Thank you, Dr. Leaning, and thank you, Rohan, and thanks to everybody. I'm so honored to be with you all today.
Thank you, Dr. Khulud. Very kind of you. So you have two substantive comments and questions and very little time in which to answer. But Rohan, I think you can manage. And apologies to our collective if you have to go a couple of minutes over, but short.
I will be very short because there's sort of the same answer to both of these things. Firstly, Dr. Elisi, thank you very much for your points, which are very well regarded. And this is exactly what I mean by the fact that a lot, building relationships and building relationships horizontally, I think, is an essential part of advocacy. And what we do, if I won't bring my slides back up, but one of the aspects of influence that we have is influencing networks. And that is really about investing our resources and our time into supporting the coordination and the co-strategization with other organizations and advocates and researchers and building those relationships better. Within Gaza, I mean, I can speak that within health advocacy, I should give a shout out to Ben Bouquet at the WHO, who's done a lot of work to coordinate health advocacy and the work that we do. But there's so much more that can be done. It's a matter of resources to invest in that. And the more that we have these sorts of meetings as a basis for creative thinking about how we can come together, the better. Within the UK, I can give an example that there are lots of other charities and NGOs who work in Palestine that also have a presence in the UK. And one of the things that MAP has done over the last year is host a consultant to create a strategy for all of us working together on Palestine development and human rights issues in the UK, so that we're better connected and better coordinated in what we do, because it means not having that duplication problem that you mentioned. So it's part of our strategy. And I think that if there was a take-home message for this conversation, it would be that, making those connections, reaching out, I'm happy for my email to be shared, for example, and trying to connect and make sure that where there are opportunities that we are coordinated, and if you're putting together an advocacy strategy, setting aside time within that to cooperate with others is essential. It's the only way to have impact on these broader intractable issues. And Khulud, thank you very much for your points as well. You mentioned something about health professionals and researchers needing to be trained in advocacy. I totally agree with that as a point. I think everyone is an advocate. And I think that sometimes it's very easy to be focused only on the sort of the research or the specific need that's in front of you. But I think that everyone is an advocate. Everyone who's alive to the issues that we work on needs to be an advocate. And we're invested in trying to, we tend to do it through our partners, but supporting our partner organizations and their staff to have some of the skills and the presentations that I've just mentioned, so that people can be out there in their communities embodying advocacy in their day-to-day work. When my best experiences of people as a person who's received healthcare have been when someone has said, well, I recognize, here's the treatment, here's something that you need in front of you, but I'm also recognize that you need help navigating this system. And I also recognize that there are people outside of the health system that can potentially help with the challenges that you're facing. And so that is, for me, a health worker embodying advocacy. And you don't need to be, as an individual, no person needs to have the weight of the occupation or colonialization and all these sorts of things on their shoulders day to day in terms of trying to resolve those things. None of us have that gift. I wish that we did. But we do have the gift of embodying advocacy in what we do and the people that we work with day to day, and putting forward some of these skills to help them either at the individual or the community level. Everyone can make that sort of difference. Everyone can have those sorts of skills. And so I'll leave it with that message.
So very well left, Rohan. Thank you for these great answers. And the questions from people are really very fundamental as well. I would just say, as you started with a quote from Rudolf Virchow, I would just like to say that he was very much an advocate. I mean, one of the things that he's most famous for is essentially going back to the Prussian government and saying the reason there is typhus among the refugees in Upper Silesia is that it is very cold and it is very dirty where they are, and that there are rats. And this is before one understood the biological nature of typhus. But he went to Parliament and said, fix the situation. So this is in the context of medicine as a social science and medicine as implicitly linked to advocacy on the behalf of those who suffer. So thank you for a remarkable presentation, Rohan. Thank you all for such great questions. And I apologize for the fact that this has gone a little over time, but thank you to the organizers for permitting us to do so.